I was the neurosurgeon on call, and the hospitalist called me saying they had a patient they couldn't wake up. I looked at the CT scan of the head that they had done, and this patient had these thin blood collections around the outside of the brain, not enough to put a patient in a coma. So I went to see the patient, and sure enough, he was just laying in the bed, completely comatose, completely unresponsive. So I looked through the clinical history, and the patient had come into the ED a few days earlier complaining of headaches. They were worried about a meningitis, so they did a lumbar puncture. That's where they stick a needle in the back and they take out cerebral spinal fluid. It's a fluid that bathes our brain and our spinal cord. And they tested it for infection. It came back negative, but over the next couple days, the patient had drifted into a coma. They were completely unresponsive now. So, looking at the whole clinical picture, these small blood collections around the brain, history of a lumbar puncture, and this slow slipping into a coma, I knew that it probably was one thing, and it's called intracranial hypotension. You see, fluid was still leaking out from that lumbar puncture hole in his back into his muscles. And what that does is you see the cerebral spinal fluid is in a column that surrounds your spine like that. And at the top of that column is your brain. Well, when it's leaking down here, it pulls the brain down into your spinal column. And that shuts down a part of your brain called the reticular activating system, which is in your brainstem. And that keeps you awake. So when it gets shut down, when the brain gets pulled down and the reticular activating system gets shut down, you just go into a coma. So what I prescribed was that the interventional radiologists do a blood patch where they take some of the patient's blood and they inject it into the lower back right around where they had done the lumbar puncture. And sure enough, the next morning I walked in and the patient was wide awake. This blood patch had taken him out of a coma and back to normal just because it stopped that leaking of cerebral spinal fluid from his low back. The scary thing about this condition is that it happens all the time and no one diagnoses it. So people just lay there languishing in comas and no one can figure out what's going on. It's something that a lot of research papers have been written on, but not that many people have the clinical skill to actually diagnose it. So this is what I do during my day job as a neurosurgeon. This is one of the interesting things that I can come across where I can make a big difference in people's lives. On the side, I have a podcast. It's called the Dr. Kumar Discovery Podcast. It's something that I'm very interested in. I put tons of good information out into the world. I tell stories. And if you're interested in hearing more from me, you should check it out. It's called the Dr. Kumar Discovery Podcast, and I hope I see you there. Cheers.